Okay, so good afternoon to all. My name is Dr. Anish and I'm assistant professor in the Department of Psychiatry at AIIMS Jodhpur. And today, before starting the topic, I would like to thank all the stakeholders for giving me this opportunity. And the topic that has been given to me, the topic is dealing with uncertainty. Right. So without further ado, I'll start the topic proper. First of all, what do you mean by uncertainty? Right? Uncertainty or certainty. This is kind of a word that is used, day in and day out. If we see the proper definition per se, uncertainty means that there is a probability of a particular outcome, but we do not know whether that outcome is going to happen or not. So as to put it very simply, at start there is that we did an act or we are about to do an act, but finally the final outcome, whether it is going to happen or not, I do not know. I have no idea. So we are somewhere in the middle ground and we do not know what is going to happen in the near future. So after introducing the topic, first the question arises that how common is it? So if you take a look at your own lives, you would see that across multiple interactions that you are having in your day-to-day life, almost daily you are having uncertainty in some or the other experience, right? And with many individuals across many scenarios. So we can say that this uncertainty or this concept of uncertainty is ubiquitous, right? It is present almost everywhere. So let us take some examples so that we are able to understand the concept in a little bit more depth. Okay, so I'll be presenting 3 scenarios. Not working. Just 1 second. So I'll be presenting 3 scenarios, right, related to daily life issues, and so that we can understand this concept of uncertainty in a better way, right? So before starting, I would say that in Hindi, that all the kahanis that I am about to tell, these does not have any resemblance to anyone, okay, and whatever coincidence is purely coincidental. Whatever resemblance these kahanis may have at some certain somewhere, right? So the first scenario is that a young boy named Ramesh has passed his NEET exam, right? Many of you would be appearing or may have appeared last year in the NEET exam, and he has got admission into an ABC medical college, right? He's in the first year of his studies, and usually, like all the first years, he would go out with his friends on weekends, to see a movie or etc. etc. And he was introduced to one of his girl batchmates, right? Let us suppose her name is Suman, by one of his friends. Then after that, he liked spending time with her and also would daydream about her, and would also chat with her on a daily basis. In a few months, his friends started to tease him, like you may yourself have experienced it, or may some of your friends may have. Teasing is a very normal part of graduate life, and the friends started to tease him and would sarcastically encourage him to ask her out, and then he finally decided to ask her out, and then he did. Right? His friends also came to know about it. And then, surprise, when he asked her out, then Suman said that, let me think about it, with a serious facial expression. And then our boy named Ramesh, he started to think, yaar, ke kuch gadbad ho gaya. And then after that, the girl did not talk to Ramesh. Right? So what happened was, then he started to be, this is where the many thoughts came into his mind. That if she said yes, then I will be very happy and cheerful. If she said no, what would she think? What would my friend think about me, etc., etc. So this scenario is one example of uncertainty. Okay. Then second example is then our boy named Suresh studied in who studied in 10th standard, is always good in studies since beginning. Mother is very proud of him, and also, as all the mothers do in front of their relatives, she would boast about him that my kid is very good in studies, etc., etc. And he prepared for the pre-board examinations, and due to as per him, due to unexpected questions, anxiety in the examination, disturbance in the exam hall, and apparent lack of time, he was not able to answer 2 questions in the science exam, due to which he was worried, obviously, and he did not tell this to his mother because he thought that she would be disheartened to hear this. And on the day of announcement of result, he saw that his score in the science exam was 72, which was very less as compared to the usual score that he got, which was more than 90. And teachers then asked him to get, to tell this to their parents, to get the answer sheet signed from their parents. And then a lot of things starts to happen in the, a lot of thoughts start to come in the mind of Suresh. So he thought that, when he would tell this to his mother, the one scenario can be mother would be very understandable. Sometimes, mother may think like that sometimes due to, XYZ reason, there may be undesirable outcomes and he will study hard next year. And the mother may be disappointed, thinking that, he may be disappointed that the mother is disappointed. And then all the thoughts starts to rush into his mind that what will my mother think about me? What are my relatives going to think about me? And what are my friends and teachers going to think about me? And then thinking about what my mother's response would be, or Suresh for that matter, there is uncertainty at that time. The third and final example, right? There are 3 friends who are studying in the engineering college. All 3 started their BTech, in mechanical or any branch for that matter. And around 9 months back, they are in second semester. There was a class test, and this may be a little bit of a different scenario for people who are, who are studying below the graduation level. But these kinds of things do happen in graduation. That they made a pact that they are not going to study for this test, and they are going to give this test without studying at all. And but Yogesh, for some reason, because he is a studious student from starting, he starts to think, I do not want to give this test without preparation. He wants to prepare it, but at the same time, he does not want his friend to think of him as uncool or studious, etc., etc. So then he is in a dilemma that if he prepares for the exam, before giving the exam, his friends may think that he is not trustable. But if he does not prepare for the exam, then there is a risk of getting low grades in the test. He may even fail the exam, and the friends will see him as a as a trustable person because he has complied to whatever he said. So what should he do? This is also an example of uncertainty. Okay, so what are the possible outcomes? One thing is that some people would deal with it, right? In their daily lives, there would not be any symptoms, but there are certain quantum of people who would have certain anxiety symptoms or mood symptoms at that time. For example, there may be psychological symptoms in the form of excessive worrying, excessive thinking about that particular scenario, excessive rumination, or maybe the chain of thoughts of all the possible outcomes that can happen, and feeling on the edge. Physical symptoms may be, for example, when a person is thinking about these things, he may start to have racing of heart, but the sensation of butterflies in the stomach, sweating, numbness, etc., etc. So these are the possible physiological, psychological symptoms that may arise if you are feeling anxiety in an uncertainty associated situation, right? So, but is uncertainty always bad? So there are the other possibilities also. For example, uncertainty with low stakes and a possible neutral or non-threatening outcome may be exciting also. For example, doing a science experiment. For example, exploring a new territory, right? So when a potentially harmful consequence is involved, then it can be highly anxiety-inducing. Right? So what does it cost? For example, as I already told, that most of the times we are able to deal with these uncertain situations and even bother to think about it. But as I said, some high stakes scenarios, but it differs from person to person. For example, some people may not be bothered at all, even with highest of stakes. For others it may vary from person to person. For some people it would be academic, from some people it would be relationship associated, from some people it may be parental issues, etc., etc. So it will depend upon person to person. But if we see that repeated uncertainties over a long period of time may lead to onset of psychiatric illness, over a long term is not good for one's physical health, and overall leads to lower level of general happiness and satisfaction with life. So we can say that it is long-term uncertainty and not able to cope with the uncertainty is important. It is important to recognize this problem because there are a lot of consequences associated with it. And now the question arises, yes, we have already discussed that uncertainty happens with, occurs with everyone, and we need to deal with it because there are long-term outcomes that we do not desire. So how to deal with it, right? If we talk about dealing with uncertainty, there are certain general measures that we can do. There are certain specific measures that we can. General measures means that it can be done at any time so as to protect a person from landing into anxiety whenever uncertainty arises. And specific measures can be done at the time of anxiety, which helps to deal better with the anxiety associated with uncertainty, right? So if we are talking about general measures, you may have heard about these things in your daily life also, some parental advice, teacher advice, etc., etc. So general measures being good lifestyle. If a person is following good diet pattern, good exercise pattern, and is having a good routine, there are more chances that he'll be able to handle an uncertain situation in a better way. Self-care exercises in the form of, if a person is doing relaxation exercise over a certain interval, doing relaxation exercises, yoga in his daily lifestyle, then he or she is well equipped to deal with an uncertain situation. Having a good social support where you can vent out, for example, having a good social circle, having a good partner, having good, teachers / parents. So having a good social support always comes in handy in handling an uncertain situation. And the fourth thing being challenging yourself and going outside the comfort zone. For example, learning a new skill. Let us suppose you want to, learn playing guitar from a long period of time, but are not able to do so. So learning a new skill, getting yourself out of the comfort zone may help in experiencing the uncertain situation in a controlled manner so as to deal better with an upcoming uncertain situation that may not be in our hand, right? And this, as I talked about in an earlier slide, relaxation exercise, this is a brief, mindfulness breathing exercise. I would like you people to, close your eyes and sit on the, you may be sitting on the chair or on the floor. That is okay. It is okay both ways. Just listen to what am I saying. It will just take 1 minute of your time, right? I'll start speaking. Sit in a comfortable position. Keep your hands in the resting position. Just become aware of you sitting and feeling the pressure of the chair or floor wherever you are sitting, and try to observe the sensations that you are experiencing, right? Try to observe the flow of your breath, observe the continuous cycle in and out. You do not need to focus on the long breath, or you do not need to increase the duration of your breath or modify it in any manner. Just observe the continuous cycle in and out. Start observing how the breath is entering your nostrils. passing through the lungs and reaching the abdomen, right? And try to relax with each passing breath, right? And at the same time, you need to remember that while you are doing so, it is natural that your mind will start wandering, right? You may get lost in the thoughts, but at that time, what you need to do is that realize that your mind is wandering and gently redirect your attention to your breath, right? If this mindful breathing exercise you are able to do maybe 15 to 20 minutes twice or thrice a day, then it will come in handy whenever you are having a uncertain situation associated anxiety, right? Now coming on to specific measures. We talked about general measures, now specific measures. These can be rational or non-rational, right? The rational specific measures are those which are based on logic, non-specific, non-rational which are based on faith. Minded, I am saying non-rational on, on the basis of the word that is used in the scientific literature. I'm not meaning that these are, not useful. Non-rational specific measures are quite useful, right? So do not take non-rational in a literal. So specific measures I'll cover one by one. First is be kind to yourself, right? It means that you may have certain friends who are dealing with, whose ability to deal with an uncertain situation is better as compared to you, right? And it can also go the other way. So it will depend upon, it will depend upon your personality, it will depend upon a lot of other factors, right? So, but you need to be kind on yourself for getting anxiety in an uncertain situation, right? And second is reflecting on the past successes. You may have underwent a lot of uncertain situations in your past, right? And you may have gotten out of it unharmed, right? So you may have, this is the time to, pat yourself on the back a little bit, so as to celebrate the fact that in the past you have come out of a lot of non-specific, uncertain situations successfully, right? Taking your own entries. The third point is that it depends upon, this particular principle is used in psychotherapy, right? For example, in cognitive behavior therapy, where you are able to take a look at a particular scenario from a third person point of view, right? You have to imagine that let us suppose that some of your friend has come to you with a similar problem, right? With a similar uncertain situation. What is the advice that you are supposed to give, that you are about to give your best friend? So that is the advice that you are supposed to give yourself, right? And then fourth is enhancing your decision making. Right? This is the decision balance matrix, right? As you can see, there are, it is a 2x2 table. On the x-axis, right, you can see staying the same and changing. I'll remind you the example that was there that I quoted in the starting. Let us take the example of the pact that you made with your friends, that whether you want to prepare for the examination or not. Staying the same, let us suppose it is that you want to prepare for examination. Then take a piece of paper, write the benefits of preparing for the exam, all the benefits that you can come up with. It may be a very simple, very simple benefit, and all the costs or all the drawbacks of preparing for the exam. And at the same time, you need to do the similar thing for not preparing for the exam, right? So when all the facts are in front of your eyes, then you are in a better position to take a proper rational decision, right? And other specific measures being seek support from those you trust. Those can be your family members, those can be your friends, that can be a partner, etc., etc. So a particular social support at the time of anxiety due to uncertainty can go a long way in helping, right? Then sixth point being thinking about what you can control and what you cannot control. I'll talk about it in next slide. The seventh point being religious coping, right? A prayer, if you are a religious person, if you consider yourself to be a religious person, a prayer or going to a religious place, maybe a temple, gurudwara, mosque, etc., would help, can help, a great deal to a person suffering from distress due to uncertainty. Then at the end, there is a concept of acceptance. The concept of acceptance being, let us take this scenario. For example, getting low marks in the exam, as was there in the second scenario. An act is done, there is anxiety or distress related to that. And from a rational thinking point of view, we can think that anxiety or distress is not going to change the final outcome, right? And we need to accept the final outcome that is there. And if we say, if we take a look at it from a religious point of view, a person may think that it is a deed of God, right? It is a will of God, and whatever God does is for the best. Paramatma jo karega, acha hi karega, right? This is the angle that is taken by the people who have high religiosity, right? So both these point of views may lead to decrease in the level of final anxiety that you may be suffering from uncertainty, right? But if still, after doing all these things, if still you are not able to handle the anxiety or distress due to uncertainty and you start to feel overwhelmed, then there is no shame in asking for psychological help. So if we go back to those three scenarios, Ramesh having problem with girlfriend related issues, Suresh having problem with marks related issues, and Yogesh having problem with friends related issues. So if these people may be following the general measures, as I told in the prior slide, having good diet, having good exercise regime, relaxation exercise, having good social support, etc., they may be having lesser chances of being overwhelmed with the uncertainty, right? If they are following specific measures at the time of anxiety associated with uncertainty, they may, if they are following a religious approach or a rational approach or all the other measures that I told in the prior 2-3 slides, they may be able to deal better with the anxiety that is associated with uncertainty, right? So with this, I end my presentation.